Now I am going to present about urticaria, allergic urticaria. Allergic urticaria is also called Sita pitta. Urticaria are also called hives. So now I am going to present about what is the difference between hives and a rash, types of urticaria, who is affected by urticaria, symptoms and causes, symptoms of acute urticaria, symptoms of chronic urticaria, are hives contagious, diagnosis and tests, management and treatment, prevention, acute urticaria, chronic urticaria. These are the pictures of urticarial rashes. Red swelling seen on surface of skin, reddish patches. Some are on the right side, and in the left side, the picture is this rashes unite to form plaques, large color size plate-like plaques. Urticaria hives. Urticarias are a skin rash that often is very itchy. It results from an allergic reaction to food or something you have touched. Urticaria can go away quickly. That is acute urticaria or last for a longer time. Chronic urticaria. Treatments may include antihistamines or steroids. Urticaria are red color bumps or splotches on the skin. They are a type of swelling uh, on the surface of a skin and happen when you have allergic reaction. Allergic reactions happen when immune system contact with an allergen. Allergens are proteins that are harmless to many people but can cause an allergic reaction in sensitive people. Urticaria are often very itchy, but you might feel burning sensation or stinging. Their size is small as fingertip or as big as a dinner plate. The medical name for hives is urticaria. Sometimes the wells from urticaria join together to form large areas called plaques. Urticaria tend to fade away within 24 hours, although they may be noticeable for several days or longer. Hmm. What is the difference between hives and a rash? Hives is skin rash that's often very itchy. It results from allergic reaction to food or something you have touched. This urticaria go away quickly, that is acute hives. Acute urticaria last longer time, that is chronic hives. Treatment may include antihistamines or steroids. What are types of urticaria? Acute urticaria refers to the hives that don't last for longer time, that is less than 6 weeks. Chronic urticaria refers to hives that happen at least twice a week for more than 6 weeks. Chronic spontaneous urticaria is the name for chronic hives that don't have an obvious cause. An older name for this condition is chronic idiopathic urticaria. There is also a condition called physical urticaria or invisible urticaria. These hives may pop up when you are in cold or heat or sun. Some people react to vibrations or pressure exercising or sweating. Physical hives usually appear within an hour after exposure. After this type of urticaria, this type, when after coming in contact with sun, if urticaria happens, this is or after exercising urticaria happens, this is chronic urticaria. Who is uh, who is affected by urticaria? Anyone can get use urticaria. If you are someone who reacts to many type of allergens, you may get hives frequently. Other people who don't react to allergens may get hives once or few times in their lives. There seems to be a relationship between acute hives and conditions like asthma, allergic rhinitis, and atopic dermatitis, especially in children. You might also be affected by hives during periods of extreme stress. Causes of acute urticaria. Acute hives are often an allergic reaction, something you put on your body like food, drink, or medication, or something you touch. The skin has immune cells called mast cells. When these cells get into action, they release chemicals, including one called histamine. Histamine is the reason that hives form. You can also get hives from a variety of other reasons. Some of these include having an infection, stress, or physical pressure on your skin. It's not it's common to be unable to determine exactly what causes these hives. What are causes of chronic urticaria? Chronic urticaria are not usually caused by allergies. They may be caused by infections from bacteria or virus or a result of other medical conditions like lupus. Your healthcare provider doesn't discover exact cause. In this case, generally, chronic hives are idiopathic or spontaneous. Krishna, chronic hives do last for longer periods of time, but usually are not permanent. They can be uncomfortable, but they are not life-threatening. Symptoms of acute urticaria. Hives look different depending on the person and situation. They can show up anywhere in the body. Signs of acute hives include rise wells or bumps on your skin. The bumps may look reddish or light colored skin. Hives blanch, that is center of hives become pale when pressed. Swelling under the skin causes puffiness. It's called angioedema. Also, appearing with painful swelling, there is painful swelling of lips, eyes, or inside of throat. Symptoms of chronic urticaria. In many respects, chronic hives and acute hives may look alike. They can be itchy, swollen, raised wells. They turn they turn they turn lighter in the center and with pressure. However, chronic hives can shift sizes and shapes. They appear, disappear, and again reappear at least few days for longer periods of time, even months or years. Happen along with heat, exercise, or stress. Are urticaria contagious? Unlike some other conditions, skin conditions, urticaria are not contagious. But if you develop urticaria because your skin is exposed to secretion from plant like poison ivy, you can spread the allergic plant product to others until you wash it off your skin. Diagnosis and tests. Allergic helps. Allergic tests helps find what's triggering a reaction primarily for acute hives. Skin test. During this test, healthcare provider tests different allergens on your skin. If your skin turns red or it swells, it means your skin is allergic to that substance. This type of allergy test is also called a skin prick or scratch test. S- Skin testing usually is not done for chronic hives. Blood tests. A blood test checks for specific antibodies in your blood. Your body makes antibodies to fight off allergens. If your body makes too many antibodies, you can develop hives and swelling. Many management and treatment. Allergy medication. Medications called antihistamines block histamine effects. They can be taken orally or topically. Antihistamines relieve itching from hives and make allergic reactions go away or become less severe. Some antihistamines react quickly, such as Diphenhydramine, Benadryl. Depending upon severity, allergy medications are loratadine, claritine, fixofenadine, Allegra, cetirizine, Zyrtec, or levocetirizine, Zizal, Krishna. Allergy shots from Allergy shots from hard to treat urticaria use monthly injections of drugs that block allergy reaction. People with severe allergy make too much IgE. These injections block immune system from making IgE. At home treatments. Take cold shower, cold bath or shower. Wear loose fitting cloths and apply cold presses. Over-the-counter hydrocortisone and antihistamine cream can relieve itching and swelling. Oral steroids. Corticosteroids such as prednisone can relieve urticaria symptoms that don't respond to antihistamines or topical drugs. Epinephrine. Severe acute allergic reactions can lead to life-threatening condition called anaphylaxis. Symptoms include hives, swelling of your place, mouth or throat, shortness of breath, wheezing, vomiting, and low blood pressure. Anaphylaxis is a life-threatening, and anyone having this kind of reaction needs an immediate epinephrine injection to open a fallen airway. Prevention. Results of allergy tests helps figure out which substance bring on acute hives. Once you know your triggers, you can avoid them. Cut certain food products out of your diet. Reduce exposure to airborne allergens. Switch to detergents and soaps without scents or dyes. Live in hope. Avoid extreme changes in temperature. Relax and take a break when you are stressed or overworked. Wear loose fitting, lightweight clothing. Some of these tips can also help with chronic hives. Chronic hives prevention. It may not be possible to prevent chronic hives. It may not be able to find exactly what causes them. They may they may be a part of bigger medical condition. Part of healing is worst. There may be a part of bigger medical condition that affects immune system. Urticaria can get better without treatment. Doctor should be consulted during following conditions. Hives or swelling, hives or swelling that last more than a week. Infected looking like bumps, red, swollen or pus filled. Recurring hives, they come long. Recurring hives, they come back even few months. Severe itching that might even keep you from sleeping. Signs of anaphylaxis including wheezing, shortness of breath or vomiting, swollen lips or face. Sita pitta or urticaria. Sita pitta or urticaria introduction. The disease Sita pitta was kept forth by Madhavakara in Rigvinishchaya. Vinay Pitaka, a book from Buddhist literature.